Hey everyone, and welcome. We're here at the Glaukos booth at APAO 2023 in Kuala Lumpur to talk about the iStent, the uniqueness of Asian eyes, and patient quality of life. Joining us is Dr. Bryan Ang of Singapore. Welcome to the show, Dr. Ang.
Thanks, Matt.
Why don't you introduce yourself a little bit for us?
Hi everyone, I'm Dr. Bryan Ang and I'm a consultant with the Glaucoma service from Tan Tock Seng Hospital in Singapore. My interest is in surgical glaucoma, specifically in MIGS or minimally invasive glaucoma surgery.
So everyone knows that Asian eyes are different. How do eyes in this region really differ from other eyes around the world?
Well, I think the main way in which glaucoma differs in Asia is in its prevalence of the different subtypes of glaucoma. So while primary open-angle glaucoma remains the most common type of glaucoma in Asia, but the other types of glaucoma such as angle closure disease, normal tension glaucoma, these types of glaucoma have a high prevalence in Asian eyes compared to other ethnicities.
So you mentioned normal tension glaucoma. What are some of the challenges that patients with normal tension glaucoma face compared to those with elevated IOP?
Well, I think normal tension glaucoma is challenging in various aspects. I think it's challenging first in the aspect of diagnosis. So diagnosis is challenging because in normal tension glaucoma eyes, pressure is within normal range and patients are oftentimes, if not always, asymptomatic. And so diagnosis is a challenge. I think there are also challenges with regards to treatment of normal tension glaucoma. So we know that IOP lowering is efficacious in reducing the progression of disease in normal tension glaucoma. But that's not always very easy to achieve, especially as the baseline intraocular pressures in these eyes are already reasonably or fairly low. And I think surgical treatment, when required for NTG, is challenging as well. And that's because of the low baseline IOPs, and that results in a narrower therapeutic IOP range. And so surgeries will have that risk of hypotony or hypotony-related complications. And those are the challenges, I think, that face us today as surgeons when we try and manage normal tension glaucoma in our patients.
So with normal tension glaucoma, what's your go-to treatment then?
Well, we adopt a stepwise approach to management of normal tension glaucoma. We begin, of course, with topical eye drop medications, and then that's escalated to surgery, particularly in advanced glaucoma or progressive uncontrolled disease. But surgical treatment in the past has been limited in terms of its options. We can consider cataract surgery alone, but cataract surgery alone, we know, does reduce the IOP, but it has minimal effect perhaps in eyes with already low pressures, and it is oftentimes not sufficient to manage the progression in these eyes. Other forms of surgery are more invasive, and these include the filtering surgeries, the traditional filtering surgeries like trabeculectomy surgery. But trabeculectomy surgery itself has got its attending risks, like hypotony again, which is higher in these sort of eyes with low pressure glaucomas. We have been used to the iStent inject in primary open-angle glaucoma. We have been confident in its safety and efficacy, particularly in mild to moderate POAG. And NTG, I think there are various considerations. We are confident in its safety profile, and we know that there is the episclerovenous pressure, which provides a protective mechanism or floor that protects against hypotony. But that in turn may actually limit its IOP lowering efficacy, particularly in low pressure eyes like NPG. And so I think the question is whether or not the iStent inject would benefit in terms of IOP lowering for these eyes already with normal, or rather with low baseline pressures.
So you've done some research on the iStent in glaucoma, is that correct?
Yes, that's right. Yeah.
Why don't you tell us a little bit about that research?
And so we embarked on two studies. The first was a retrospective study, where within this study we looked at a subset of about 23 eyes. And we found that the iStent inject combined with phacoemulsification surgery did have a statistically significant reduction in anti-glaucoma medications by about 1.2 to 1.3 medications by the end of 12 months after surgery. We followed that up with a prospective study where we examined 30 eyes, looking at the safety and efficacy of the iStent inject combined with phacoemulsification, again in normal tension glaucoma eyes in Asia. And we found a statistically significant reduction in both intraocular pressure by about 1.2, 1.3 millimeters mercury again, and a concurrent reduction in the number of medications by about one medication by postoperative month 12. And I think importantly as well, while all the eyes at the start of the study were on at least one glaucoma medication, by the end of 1 year, we had about 83% of eyes that were completely off medications with no evidence of progression of visual field as well. The remaining 5 eyes were on medications, had advanced disease.
So was this all expected? I mean, I guess one of the most fun things about research is the unexpected things, right? What were some of the unexpected or surprising things you found in your study?
Well, Matt, we were not surprised by the safety outcomes of the study. We have been using the iStent inject for a number of years before the study on primary open-angle glaucoma, and the safety results were impressive. And we weren't surprised by what we saw in this study. But I think what was very good to know was that despite the episclerovenous pressure flaw that I described earlier, that sort of protects against hypotony, but conversely also may limit IOP lowering efficacy. Despite all that, the iStent inject combined with phacoemulsification at least did prove to be efficacious in reducing both intraocular pressure and medications to a certain extent up to 12 months after surgery.
So for all the patients you've implanted with the iStent, what are they saying after they're done?
Well, I would say that they're pretty happy with the outcomes. I do most of my iStent inject surgeries in combination with cataract surgery. So they're very happy after the surgery for a couple of reasons. I think they really love the better vision, and of course that's attributed to the cataract surgery aspect of this combined surgery. At the same time, I think they really feel the beneficial effects of not needing medications after surgery, or at least having a reduced medication burden. There are many savings in there, savings on cost, inconvenience, and the medication side effects that we saw before surgery oftentimes would resolve, and the patients are really appreciative of that.
Yeah, I mean, I think quality of life is a really, really big issue with glaucoma. You have, as you said, eye drops, maybe some of the preservatives. So how have you seen the iPact really impact patients' quality of life?
Well, I haven't done personally a study on that, but I think that's a very important area which we all need to look into. The actual impact and effect of these surgeries on the quality of life. It's not just intraocular pressure lowering or reduction of medication burden. So while we anticipate that to have improvements in terms of quality of life, I think studies really need to be done in this area in mixed surgery.
So overall, what's your opinion on the use of the iStent?
I would strongly recommend that the iStent inject is a consideration. We know it's proven already in mild to moderate primary open-angle glaucoma. And in my experience, in the use of combined surgery, phacoemulsification with iStent inject implantation, I think the patients have done reasonably well, and I think we have shown that also in the studies that we put out there.
So with all of this experience in research and in the operating theater, what are some of the recommendations or things you would say to new surgeons considering using the iStent?
Well, I think for new surgeons who are considering the iStent or any form of angle mixed surgery, I think it's firstly important to understand the concept of the surgery itself, to understand what exactly the device does in the context of the iStent inject, to understand angle surgery, to understand angle anatomy, to understand the episclerovenous pressure and the concept of that and how that works. That's the first. I think secondly, in terms of surgical technique, it's important for them to be very familiar with intraoperative gonioscopy surgery and to be familiar with how the angle looks and what to do in the angle during surgery as well. At the same time, I think it's important to keep abreast of all the data and all the literature that's really coming out, as it's always evolving and emerging. And so it's important to keep abreast of all this information so that they can choose what is best for their patients, what's most appropriate for their patients, so that they can give them the most personalized care available.
Perfect. And again, if you mentioned patients, if you're a patient maybe as a candidate for the surgery, or your doctor is telling you, hey, you might, you were considering implanting the iStent, what would you say to them?
I would tell the patients to give serious consideration to iStent inject surgery in combination with phacoemulsification, given the experience that we have had and the data that we have put out already. At the same time, I think it's also important for patients to understand that every eye is different, and that they need to really consult their attending surgeon, who would be able to advise them best on what surgery is most appropriate for them, given their knowledge of their eye condition. So I think that's really important to have your surgeon advise you. There's so many surgeries out there. It's important to know what is best and most appropriate for you. So that's what I'll tell patients.
Perfect. Well, Dr. Ang, thanks so much for sharing all this expertise on your research and your experience with this device. Really appreciate you joining us today.
Thank you, Matt. Thank you.
And to all of you out there, thanks for watching and see you next time.